evidence-based way to address complex problems that no one organization can tackle on its own. With over 20 years of roundtable experience, the American Cancer Society serves as the backbone organization, providing leadership and expert staff to support and unite organizations in collaborative partnerships. Together, the roundtables provide a neutral platform to convene diverse stakeholders. When we do that, we can establish national priorities, catalyze coordinated solutions, build and translate evidence-based strategies into practice, and leverage the knowledge and experiences that inform the reduction of health disparities. And next, I'm going to turn things over to Jane to tell you a little bit about our roundtable's leadership.
Great.
Okay.
Thank you so much. We're really privileged to be able to have some amazing leaders in the cervical cancer space to join us here with the roundtable. And so if I could have, great. So I'm going to introduce you to our tri-chairs or the roundtable. First up, you'll see Deborah Arundel. She's the Vice President of Health Policy at the American Sexual Health Association. We also have Dr. Akiva Novetsky, who's a gyne oncologist at Westchester Medical Center in New York. And then we also are joined by our ACS Tri-Chair, Dr. Debbie Saslow at the American Cancer Society. Next slide, please. We also have a steering committee that has been identified and appointed, and you will see their faces here. And we just shout out to those folks on this screen who stepped up to the plate to be on our steering committee. And really, as we designed this steering committee, we sought members who work well collaboratively, represent expertise from across the cancer continuum. They are all champions of health equity. There are people who have lived experiences or work with populations that experience health disparities. And we also tried to represent people from all across the country, and so that they can bring their own perspective from their own regions. And so once again, thank you to those who are on our steering committee and are taking this leadership role here. Next slide, please. And then we'll introduce you to our staff. I see some familiar faces here on our call. And so Dr. Debbie Saslow is our tri-chair, as mentioned, and our ACS subject matter expert. Shelley, who introduced the call, is the director of the roundtable. I am next, and I am a program manager for the Primary HPV Screening Initiative, which is an initiative nested under this roundtable. And then we also have Courtney Van Ord, who's our program manager of the roundtable. And then you'll find our email to the roundtable there at nrtcc@cancer.org, and that can be routed to any one of us via that email address. Next slide. Thank you. I won't read all of this slide to you, but we wanted to just highlight the different areas of expertise that our team brings, and almost a who to go to for what kind of slide. And so as you can see here, we represent a lot of different areas of roundtable operations and knowledge and expertise here. And so we hope that if you have any questions, we will appropriately route that and handle that request. So thank you. Next slide.
And so while cervical cancer was once one of the most common causes of cancer death for American women, the cervical cancer death rate has dropped by nearly 70% with the increased use of cervical cancer screening. And recent data from women ages 20 to 24, who were the first cohort to receive the HPV vaccine, have also showed a 65% reduction in cervical cancer incidence rates from 2012 through 2019. And what does that mean? That means that the US is on track to eliminate cervical cancer as a public health problem by 2046. And it's even possible that through the work of the roundtable, we could move elimination timing forward if we can get higher screening coverage achieved. But to put it simply, if we work together, we can achieve the vision of a world without cervical cancer. And so when we formalized the mission of the Roundtable, we, and I am going to read this because I think there's power in saying the words, that ACS NRTCC is a national coalition of member organizations who, through collective action, will tackle disparities in cervical cancer prevention, screening, and treatment in order to eliminate cervical cancer and reduce the harms caused by the disease. That is a very powerful vision and mission, and we're excited to have you all be a part of that. And to tell you a little bit about how we want to work to reach that vision and mission, because how we get there is just as important as that we get there, Courtney's going to tell you about our commitment to health equity.
Hello, next slide, please. So the ACS NRTCC believes that every person should have a fair and just opportunity to prevent, find, treat, and survive cervical cancer. We have really been very intentional about our team that we have in place and everybody that we've selected for work groups and all of you being as we are centering that health equity in all that we are doing. And we've been very intentional about doing that. So in order to do that, center that, we are going to ground our work in data and context. We're going to focus on policy and system changes. We're going to listen to and act in concert with the community. And we really want to share the decision-making power. And we want to build equity and leadership and accountability. And we want that to be, this isn't just a one and done. This is something that we are living and breathing. So this is all throughout. We want your feedback. We want to know if we're really doing this. And we want to constantly review that. And so we officially launched, we were in our phase 2 here, but you'll see phase 1, the first 6 months, we kind of launched our website. We had our event in October. We brought together an advisory council and a steering committee to kind of really kick off everything and see what the next steps needed to be. We secured funders and then we did a national needs assessment. And so now we're in that growth space where we've already identified our priorities, but we're working to engage member organizations, which is all of you, and our strategic plan, we're creating that. And then we have our work groups that we're putting together that will be starting up here in this next month or so. And then our first official national meeting will be in October. And then looking forward to years 3+ will be the maturity phase. So that's where it's going to be kind of where everything's been established and we're just supporting committees and work groups and leading that national dialogue. Next slide. So we had our official launch on October 24th, 2022, and that was in response to President Biden relaunching the national or the cancer moonshot. And so we accepted the charge to lead and start this roundtable for the nation. And so these are some photos from that day. It was a wonderful day. We launched both a breast cancer roundtable and a cervical cancer roundtable that day.
And to set the work group priorities for the roundtable, we first wanted to understand what are the greatest needs and what do people want from a national roundtable. To answer that question, we spent year 1 conducting a national needs assessment. So as ACS NRTCC was forming, we started by conducting 13 key informant interviews with cervical cancer experts to get an idea of what they thought we should be focusing on. Then we challenged our assumptions and sought greater insight so we could create solutions to these problems in ways that meet people where they are. And to do that, we began our work by listening to the needs of those who are impacted by this disease and collected qualitative data from interviews, focus groups, and community conversations. Those conversations were then analyzed and the emerging themes were then integrated into a survey. That survey was shared nationwide to determine our initial roundtable priorities. And it was important to us to receive representation. So you can see a few things listed out here of people who participated in our focus groups, in our stakeholder surveys, and in the survey. So no participant was required to declare their race or ethnicity, but they were allowed to select multiple categories. We tracked race and ethnicity for both community conversations and focus groups. And for the survey, we gathered information about the identities of the participants, such as if they were a community member, a provider or a clinician, as well as race, ethnicity, rurality, and whether or not they were a person with lived experience or if they'd had a connection to cervical cancer. Using grounded theory, the data were analyzed and common themes were established. The most poignant themes were the need for patient and consumer education, provider and clinician education to address the stigma associated with cervical cancer, to increase primary HPV and self-sampling and getting ready for self-sampling once that's FDA approved, and to address access issues. So in March of 2023, the steering committee's roundtable created work groups around each of these top 5 thematic areas. Sub-themes and more detailed qualitative data that were gathered inform short and long-term goals for each work group. Those work group members are being identified now, and the work groups will be convening in the next month or so to determine their strategic plans moving forward for 2024. Jane?
Great, thank you so much. And now we're going to kind of tailor the conversation to membership and what that looks like more specifically for you all as members of the roundtable. And so on this slide here, you'll see membership benefits, and we'll start with access. So by being members of the roundtable, you all gain access to the latest news, events, tools, resources. We also will have an annual meeting where you can network, get ideas, and get up-to-date information about cervical cancer across the continuum. And you will also help us tackle complex barriers that challenge cervical cancer prevention and other areas of cervical cancer work across the continuum. Collaboration. So members are provided pathways for the collaborative work on various initiatives designed to leverage the member talents that you all bring and the expertise that you and your organization have in order to address the pressing needs around cervical cancer screening, prevention, care, and support, to name a few. And also, members help to lead the national dialogue on cervical cancer and receive this recognition on our website, within annual reports, social media, and many other channels that we have. And overall, we need you all as mission-driven collaborators to do the work that is needed to realize our vision of a world without cervical cancer. And so we here at the ACS NRTCC value and appreciate you all as members, and we look forward to recognizing all that you are going to bring to the roundtable. Next slide, please. All right. So we have several different membership categories, and I want to highlight those different categories. So we have organizational members, we have government members, corporate members, and then individual members. One thing to highlight around individual members, this is an invitation only for those individuals who are asked to participate in work groups, and in rare occasions, they may be invited to the roundtable as members at large. But overall, you are all here as a member representing your organizations. And so those would fall under those different categories of organizational member, government member, and corporate member. Next slide, please. So as we're getting up and running here with the roundtable, there are some things that you can do today or in the coming week about how to start your engagement with the roundtable. The first of that is to subscribe to our newsletter. The next is to follow and share on our social media. Also, you can bookmark the ACS NRTCC website. And then lastly, you can watch for ACS NRTCC events and announcements. And you will see those links that just got dropped into the chat for you all to click and use them on your own browsers. Next slide, please. And just to summarize here, Shelley did an excellent job of sharing our mission and vision here at the ACS NRTCC. And then we just wanted to leave you with what is the member duties of for you all and the responsibilities that you will carry. And so you'll see those bullet points on the right side of the screen here, where you'll designate official representatives, commit to advancing health equity and the mission of the Roundtable, regularly report out on Roundtable activities and your contributions, participate in work groups, committees, and collaborative projects as they arise, disseminate Roundtable materials. We also ask that our Roundtable members promote the Roundtable on social media, participate in interviews and surveys as requested, and attend our national meeting. Next slide, please.
Now, of course, none of this great work would be available without the generous contributions of our sponsors. And because we are just getting off the ground and always looking for those generous contributions of our sponsors, to see the most current list, you can check out our webpage or you can scan the QR code on your screen. If you happen to have that expert knowledge of an organization or a business that you think would make a great sponsor, have them go to the website, or you can click on the link that's being dropped in the chat to get the sponsorship form and forward that on to your network. Where does the magic happen on a roundtable? Well, one of the places that magic happens on a roundtable is in our work groups. And work group participation is voluntary, and it generally involves attendance on a monthly 1-hour video call. Membership is a 1-year term with an opportunity to renew or provide a recommendation for a replacement. So if you're stepping down, you still have just a little bit of work to do. Participants are usually asked to do things like review items or complete other small tasks outside of the standing meetings, though any additional time commitment is expected to be limited. And for work group members, traveling to in-person meetings is not currently anticipated. But let's introduce you to those work groups and to the leadership. First, the Clinician Education and Messaging Work Group, who's taken on the priority to utilize education to achieve the best care for the most people. This work group is co-chaired by Dr. Lisa Soltani, who is in Arizona working as a primary care physician and as the medical director for El Rio Health Center. Dr. Margot Savoy is in DC and the senior vice president for education and inclusion at AAFP, and has also served in a leadership role on the HPV Roundtable. Our Patient Education and Messaging Work Group said they wanted to do the same thing, so education should achieve the best care for the most people. They're just tailoring everything to their specific audience of patient and community members. Leading this work group, we have co-chairs Jennifer Lucasis, who from the DC area directs the communications team at the NCI Division of Cancer Epidemiology and Genetics, and Nancy Pena, who is in the Boston area and is the director and founder of NPI, an international patient navigation program that provides training in Spanish to patient navigators. To address the issues of access to services across the cervical cancer continuum, we have Dr. Catherine Chung Bridges, who is the Director of Research in Miami, Florida for Health Choice Network. She's a public health researcher who champions systems change. Co-chairing this work group with her is Donna Williams, Dr. Donna Williams, who is the Director of Louisiana Cancer Prevention and Control, where she has over 25 years of public health experience reducing healthcare disparities. Next, I want to introduce you to our Stigma Work Group. This work group's priority is to reduce the harms caused by the stigmatization of cervical cancer. To lead this work group, we have Teresa Coley-Claudio, who is a certified nurse midwife practicing in Alaska. She is an LGBTQ champion and is also dedicated to working with Native and rural populations. Co-chairing this work group with her is Kimberly Williams. She is a cervical cancer survivor from Texas, who is also the Diversity, Equity, and Inclusion Director for Survivor, that's CERVIVOR, and a social worker working with people with intellectual disabilities. Our self-sampling work group has made it a priority to drive increased use of primary HPV and self-sampling screening pending FDA approval. This work group is led by Dr. Kathy McLaughlin from Minnesota, who works at the Mayo Clinic as a family medicine provider, where she also researches multi-level interventions to improve cervical cancer screening and reduce disparities. Alongside her is Dr. Philip Castle from the DC area, who's an epidemiologist and the current director of the Division of Cancer Prevention at NCI. Our primary HPV screening committee is a continuation of the Roundtable's primary HPV screening initiative, which will be sunsetting soon. Their priority is to continue to strategize the complex barriers and address the complex barriers and opportunities around HPV primary screening. Courtney?
Okay, so for anybody that has maybe been involved in another roundtable, more so the HPV roundtable, you all would know that we love a theme. So we've got our national meeting coming up, and we are going to the National Islands in Atlanta, but we're gonna create the scene when we're there. So it's gonna be October 18th to the 19th, and you can register here by scanning the QR code, or I'm gonna drop the link in for you. And this is going to be, we call it a national meeting, but we're doing this whole unmeeting idea. So this should be the most fun meeting you've ever been to. That's our goal, for it to be fun, engaging, for you to come out feeling like you've taken away more than you have from other meetings. So it's not going to be traditional style, but you will be learning some best practices, health equity. We'll have discussion on health equity. We'll hear from different organizations, and there will be a lot of engagement. So there's going to be a lot of hands-on, and it's guaranteed to be fun. Food will be good. And so make sure you register today or as soon as possible. I will also send out a link after the meeting for you to do this as well.
One of the exciting things about this national meeting is that we are working in collaboration with the HPV Vaccination Roundtable. So not only will you have all of the wonderfulness of meeting our members and getting that information, but we're also going to be able to cross-collaborate with our sister roundtable, the HPV Vaccination Roundtable.
All right, so that leaves us with our action items. So we have dropped in those links for all of our socials for you to be able to follow the social media channels. And then you can visit our roundtable, or cervicalroundtable.org for more information. You can sign up for the newsletter there. We'll be sending out newsletters based off of who's registered there. You'll also be able to see our resources. And then lastly, registering for that national meeting for October 18th to 19th. So this is where we would like to thank you all for being a part of the roundtable, and we wanted to leave some space for questions. So please don't be shy. We are happy to answer any questions you may have.
Okay, I'm going to stop sharing my screen so I can actually see your beautiful faces. And this is where we want to get you used to reaching out to us, and feel free to satisfy your curiosity about any of the things that we've talked about, or things moving forward. Did we have any questions that came through the chat?
There is, what is the cost to attend the annual meeting? Came through. So there is no cost to attend, well, cost for the conference. It is for your travel and a hotel or wherever you choose to stay, that is on you, but the conference itself, there is no cost for the meeting. And then there was a question if there will be any online participation. And unfortunately not this year. We're looking at doing a hybrid, or we're doing this year, we're doing in person. Next year we'll do an online. So every other year we'll be switching on. Shelley, when will work groups be finalized?
That's a fantastic question. This month we are going to be doing our second meeting with our work group chairs, where they're going to be looking at members. So in a very optimistic world, we are hoping to have our work group members meet before the end of August, and then have one more very robust working meeting in September before our national meeting.
Also, Shelley, the slides were incredibly helpful. Do you, when do you anticipate, I guess, sending these out to participants? Because they will be coming.
We can make those available to participants probably by the end of the day. Also, we anticipate taking this meeting, and we have recorded it and the other orientation call. We're going to create some small videos to kind of answer those frequently asked questions, and that'll be available within a few weeks, we think, on the website. So people can go on there and revisit today.
Okay. Another question, Shelley, can you share what the difference is between a work group member and a member organization?
Yes, so the Roundtable is made of member organizations. Those are, you serve as a representative for your organization on the Roundtable. For our work group members, what we're looking for is who among our members has the expertise that we need to meet a specific goal. So for instance, if the Access Work Group is looking at doing policy, then our chairs are going to be looking at our member organizations to say, who has expertise in policy? What steps do we, so we can find out what steps we need to take, what we can do, who we should bring on board. And then they'll send out invitations to say, hey, we're working on policy. Who at your organization is the person we should get in contact with? And then you can recommend that person to us. We'll bring them on board to the work group to serve in that capacity as an expert for a little while. And then that will sunset with projects.
Okay, so to follow that up, Shelley, Holly had asked if we'll be assigning members to work groups, or are we looking to see if people would like to volunteer for work groups?
So one of the things we did with that all-important form we kept pestering you about was asking, where are you interested? And if you've completed that form, then we have shared, well, we are sharing this month that information that your organization is interested in participating in this work group. And so as our chairs are looking at which projects they're gonna start off with initially, they'll be reaching out. But it all kind of, the final call is our work group chairs.
Jane, what is the anticipated time commitment for regular members?
Great question. For some months, it may be nominal, such as email or anything that comes through your inbox. If you are not on a work group, other months, there may be an ask for your organization to review something or to contribute to something. So that will vary.
Thank you. And I believe that's all the questions in the chat. Does anybody want to come off mute and have anything to ask?
I do. Hey everyone, it's Debbie Saslow at ACS. I was monitoring the chat, so I may not have heard if Shelley said that, so I apologize if I'm repeating. But I know that with some of our other ACS roundtables, we asked all of the members to serve on a work group, and the model has been changing as we've been gaining experience and learning more. So most members will not serve on a work group. And there's good reasons for this. We really appreciate that people want to be active in that way. But the most important role for you as members is, one, to help us decide what the priorities for the work group should be. When a priority is no longer a priority, maybe we've filled a need or technology has changed and there are new needs, there might be an ad hoc committee that's needed or something new coming down the road. So you'll help determine what those work groups do, whether there are experts in your organizations who might serve on a work group when a new topic comes up, say next year, but also as the work groups are drafting materials, if that's what a particular work group is doing, whatever, I use the term material very loosely, we'll be asking you as members to review, to say we missed an important piece or a nuance, and to sometimes bring that back to your organization, to bring to the roundtable data that your organization has about, wow, what that work group did is going to work great in most of the country, but not in these populations. Our organization can volunteer to customize it. Once materials or whatever that output is finalized, you will be the ones to bring what the work groups do and the information they gather and the recommendations they make back to your organizations and figure out, how can we promote this? Does our stakeholder group, if we're a provider group, do we have a role in taking the recommendations from the provider education work group and incorporating some of this into the types of education that we do for our members? Things like that. So there are a lot of important roles outside of the work groups. The work groups are going to be a pretty specific focus, working month to month for a discrete amount of time.
Thank you, Debbie. Anybody else have anything they would like to ask or contribute?
There's a question in the chat from Virginia. Can we send our interest in work groups over email to ensure that we have expressed our interest correctly? Yes, you can always email anyone on the staff.
Yeah.
And we have a lot of behind the scenes tracking mechanisms where we take your information and keep it all in one place and tag it so that anytime we're searching for something, we will find you.
So we just had a question from Denise Smith asking, how do we define providers for the provider work group? This is a wonderful opportunity for us to tell you how we work to keep ourselves accountable. So we created the provider work group because that was the vernacular that came out in the formative research. But in the first meeting with our provider education work group chairs, there was a question of, are we really wanting to use provider or should we use clinician? Because really what they're trying to get at is to reach everyone that's in that medical setting, from the person who's doing the intake at the front desk, the patient navigators, community health workers, the nurses, the doctors, anyone that's in that clinical setting. That group is what they're really looking at providing that information for. So we have taken under consideration, we should probably change provider to clinician, but that happened just a little bit ago. And so we haven't got everything updated yet. We're making a list of all of the resources that we need to go back in and change that information on now. So as you see, as things go, we will be responsive to change as it comes around. But I'm assuming that was going to be your question, Denise. Did I answer it?
Yeah, thank you. And good afternoon, everyone. And thanks so much for inviting the voice of community health workers and the National Association of CHWs. Yeah, I was asking one because the majority of CHWs are not working in health systems or medical settings. But nevertheless, there's a core competency for the workforce around patient navigation. I'm a CHW by identity, but I'm also trained as a patient navigator with Dr. Freeman. So wondering again, if we are talking about the community-based workforce that provides connective tissue and often supports early detection and screening, as well as misinformation and navigation across systems. So wasn't sure because I'm brand new here, but looking forward to the discussion.
Yeah, and Denise, we do have community health workers and patient navigators included on being recruited, and actually our chair is a community health worker as well. So it's definitely, we want it to be all at reaching all avenues. Okay. Any other questions before we wrap up?
was going to say we have a few minutes left. If people are interested, we can do a very quick 30-second, here's who I am and the organization I'm representing round robin. Would people like to have that opportunity? I am seeing heads shake. So
Say a yes, and I'm also going to do a 30-second public service announcement. Community health workers, navigation, you have been called out in the recent Medicare something or other for comment, as well as CLIA and a whole bunch of other stuff. So please get your organizations to look at that and comment. And Jane, you're the one who gave me the link. So if you could drop that in the chat, that'd be awesome.
yes, the Medicare physician fee schedule proposed rule. That's what we're talking about. All right.